Mr. Chairman. For our opening statement, I now yield to the ranking member on the House Subcommittee, Mr. Stark.
Thank you, Mr. Levin. Thank you, Chairman Camp, for holding this hearing to review the President's budget in regard to Health and Human Services, and I look forward to hearing from Secretary Sebelius and thank her for joining us today. The President outlined a tough budget on a number of fronts. I wouldn't have made all the same choices, but I commend the President for trying to walk the fine line of reducing the deficit and continuing to meet people's needs. In contrast, the House Republicans are debating a job-killing continuing resolution that independent analysts confirm would destroy 800,000 private and public sector jobs, cause the firing of thousands of police officers, firefighters, other public servants around the country, and kick more than 200,000 children out of Head Start. A particular concern for today's audience is that we would endanger the ability of Medicare to pay doctors, hospitals, and other healthcare providers who treat Medicare payments threatening or patients threatening seniors' access to health care. I'm pleased that in his budget the President proposed improvements to several vital programs within our jurisdiction, including foster care, child support enforcement, and child care. We look forward to working with the administration to ensure these programs are protecting children, lifting families out of poverty. In crafting his budget, the President acknowledges that the health reform law includes significant entitlement reforms to Medicare, improvements that will extend the lifetime of Medicare by 12 years, according to CBO, and the Affordable Care Act, which reduces the deficit by $230 billion between now and 2019, and more than $1.2 trillion in the following decade. My friends on the other side of the aisle have been talking out of both sides. At a hearing last week, they're talking about how health care reform did too much to cut Medicare, and this week we're saying we need to cut even more out of Medicare, and supporting a Republican roadmap that would turn Medicare into a voucher system. Taken together, Medicare changes in the health reform law add up to a significant, meaningful entitlement reform, but reform that protects taxpayers, the program, and the beneficiaries. The health reform law makes Medicare stronger, improves benefits for all beneficiaries. Senior citizens, people with disabilities who receive care through Medicare will have lower premiums for medical care and pay less when they go to the doctor or pick up prescriptions. Given the historic health reform effort and its deficit reduction achievements, it comes as no surprise that the President took a light touch to the health programs in his budget. As we might say, we've already gave it the office. I look forward to hearing from the Secretary about why the President made the choices he did in his budget, and I'm sure we'll have a lively discussion after that, Mr. Chairman. Thank you very much.
Thank you. Again, Secretary Sebelius, welcome to the Ways and Means Committee. Your written statement will be made part of the record, and you have 5 minutes to summarize your statement, and you may begin. Thank you.
Well, thank you, Chairman Camp and Ranking Member Levin and members of the committee. It's my pleasure to be here today to discuss